Hi HCHC family, thank you for joining me on our first official episode of Compliance with Candice, which airs every first and third Monday of the month between 11 and 2. Don't forget to like, comment, subscribe, and share. So today you are joining me in our classroom where we recently completed our WIO training. WIO, meaning Workforce Investment Organization, is a managed long-term care program which is going to support our healthcare workers by retraining them. It is also a collaboration of Medicaid, Medicare, and the Department of Health. Today, I want to go over some of the material that will be covered during the training. We want you to be able to keep your client as healthy as possible, and we also want you to know what to do in case of an emergency. The purpose of WIO is to support the expansion of home care. We want our patients to stay home. It will also reduce the cost of ER visits and hospitalizations. In doing our part to help our members stay home and out of the hospital, we are retraining all of our aides. This training will consist of 4 courses over the period of 2 days. The role of the aide is to observe your client, record what you observe, and report it to the appropriate person. This is also called look and listen, bump it up, and share it. Look and listen. When we are observing our patients, we are looking to see if their symptoms are getting better or worse. For example, if I have a client that has a bed sore, I will want to be sure that it is getting better, not worse. We need to look for red flag symptoms. An example of a red flag symptom could be if my client is diabetic and they tell me that they are lightheaded, it could be a possibility that their blood sugar level has dropped. Our role as an HHA would be to follow the plan of care. It is our responsibility to be sure that the plan is being followed and doctor appointments or follow-ups are being attended. We are also looking for changes in their mood, emotions, and their ability to think clearly or express their thoughts. For example, if my patient is naturally a lively person and suddenly they're down and quiet, as a caretaker, I would be looking to see if there's a change in their environment, meaning, did someone close to them leave? If no one recently left, whether it be travel or death, and there was no change in their environment, this can be a sign of oncoming depression. The same is true for a patient who is normally grumpy or quiet. While it is true that your amazing work as a caregiver has changed them for the better, or a miracle is in the air, we are still paying attention because this could be a sign of manic depression. Bump it up. To report your observations, you would contact the patient's nurse, doctor, or coordinator. At house calls, there is a chain of command, and you should first contact the patient's coordinator. If your issue is not resolved, you can also contact the supervisor, the manager of patient services, and the director of patient services. If you need to report observations after 5 p.m., you can still call the office because we have our on-call and customer service, which is available 24/7. You can also email us at cs@housecallshc.org. Share it. When sharing your observations with the client's family or significant other, please always be mindful of the HIPAA regulations. Ask the patient's coordinator first who you should speak to. Just because the client's family member is around and asks questions does not mean that they have rights to the client's health information. One of your most important roles as an aide is to look and listen, bump it up, and share it. Just take a picture of the screen as a reminder. Remember, communication is not only speaking to someone, it is also observing, listening, recording, and reporting. In doing this, you should remember SBAR. SBAR, Situation, Background, Assessment, Recommendation, is a technique that provides a structure for communication between the home health aide and members of the patient's caregiving and healthcare team about the patient's condition. S, Situation, a brief to the point statement of the problem. Who are you communicating with? State your name and title, state the name of the patient, and briefly state the problem and when it started. B, Background. State important and brief information related to the situation. A, Assessment. It is okay to share your observation of what you think is going on. R, Recommendation. What do you want to see happen? What do you think has to be done? Are you a good listener?
Do you make eye contact?
Yes.
Do you wait until the other person finishes talking before sharing your thoughts?
Yes.
Do you use short sentences to show the other person you are listening?
Yes.
Do you ask questions to make sure you understand what the other person is saying?
Yes.
Do you try not to use questions like yes or no?
Yes.
Do you use a friendly and respectable tone?
Yes.
Do you hear the emotion the other person is feeling?
Yes.
Do you stay open to hear the other person's feeling, even if you disagree?
Yes. If you answered yes to most of these questions,
you're a good listener.
If not,
you can still try again.
Earlier, we mentioned observing so you can report to the doctor. Well, here's a few steps to follow to prepare you for the doctor's visit, what to do at the doctor's visit, and steps to follow after the doctor's visit. Make the most of your patient's time before the visit to the doctor by preparing your observation notes and bringing them with you. If the visit isn't a follow-up but an emergency visit, be sure to state all symptoms. If it is a follow-up, tell the doctor all of the changes since the last visit. Bring the medication list with you if going to the ER or urgent care. Be sure to write down all instructions and the next appointment date. During the visit, if the client does not wish for you to be there for the consultation but needs translation, be sure a family member can go with you. Write down all questions the client may have and give it to the doctor when the doctor arrives. Don't be embarrassed to ask the same question twice. Be sure you understand the doctor's answer. Write down all answers for future reference. If going to the ER or urgent care, be sure to ask the doctor for their contact info. Don't forget to take all available brochures with you. After the doctor's visit, be sure to go over the notes with the client. If there are any significant changes in health as noted by the doctor, be sure to advise the agency because it might be time to increase the hours. The contact information received during the visit, please be sure to place them somewhere the client will be able to find it easily. Follow all instructions given during the appointment. Continue to look, observe, and report on your client. And remember, the next doctor appointment should be changed if any emergency arises. Thank you for joining me on this episode of Compliance with Candice. If you have any questions, feel free to drop them below. Next time we will discuss zones and also emergency preparedness. I hope to see you all there because quality begins with you.